This is Ashley recording for Tracy Pearson. She'll be performing tracheostomy care.
So I'm going to review the doctor's orders. I'm going to determine if my patient has any latex allergies. If not, hello, my name is Tracy. I'm going to be your nurse today. Can you tell me your full name and date of birth? Perfect. I came in this afternoon to do some trach care. Is this a good time for you? Okay, let's go ahead and get started. I'm going to pull the curtain. I'm going to perform hand hygiene, and I'm going to put on clean gloves. At this time, I want to observe the condition of the tubing. I want to check the surrounding skin. I want to note any signs or symptoms of airway obstruction. I want to encourage my patient to cough out any secretions. I'm going to go ahead and listen to the lungs. I'm also going to take note of the respiratory rate and depth. I'm going to reload my gloves. I'm going to wash my hands. I'm just going to gather my supplies. So I have my supplies. I'm going to go ahead and set my patient up. Okay. I'm just going to put this pulse ox on your finger, okay? So I can just monitor your oxygen levels while we're doing this. And I'm going to put this towel across you, just in case I create a mess, okay? Hopefully that won't be the case, but we'll protect your gown if I do. At this time, I'm going to go ahead and put on my goggles, or I could use a face mask or a shield if I needed to. I'm going to go ahead and wash my hands. If my patient was on oxygen, I would, at this time, hyperoxygenate my patient according to agency policy. I'm going to go ahead and have my assistant bring me a new kit, please. I'm going to dispose of all this. So this is going to be now my unsterile hand. I'm going to turn on the machine, make sure that it's between 100 and 150. Connect my tubing. And I want to make sure that this is working correctly. Just going to slide this over. Wait until I make resistance. Go back a ½ inch. All while I was doing that, I would want to encourage my patient to cough and deep breathe. Shut that off. Remove my gloves. I'm going to perform hand hygiene. I'm going to put on clean gloves. And at this time, I want to make sure that this is back over. At this time, I'm going to perform oral care. I then want to compare my respiratory rate and depth and my pulse ox with my previous baseline assessment. I'm going to go ahead and auscultate the lung sounds here. We auscultated the lung sounds. I am going to remove my gloves, wash my hands, and set up for the next part here. This is my biohazard bag. time, I'm going to make my left hand my non-sterile hand. I'm going to remove the inner cannula, dispose of it in my biohazard bag. Till it clicks. Aseptic technique is done. I'm going to oxygenate my patient at the order level. I'm going to apply new gloves. Clean around the stoma in a circular motion. I want to take note of any redness or any drainage. I'm going to dispose of that. Clean the top. Circular motion. I am going to dry. I'm going to get a new one and get it wet. I want to clean the face plate. And then I'm going to get a new dry 4x4 or 2x2, and I'm going to dry it. Dispose of that, and never want to remove your old trach ties until you have new ones in place or you have somebody here to hold the trach. Excuse my reach here. Are you doing okay? These things are tricky. Excuse my reach. I'm just going to go ahead and thread this behind your neck here, okay? You want to make sure that you can fit one finger underneath, that it's not too tight, but tight enough it's not going to move. Remove our old trach ties. Now lift your head here. I'm going to dispose of this. And I'm going to get a new drain sponge. How are we doing? Are you comfortable? You want your head down here a little bit? We'll put your head back down a little bit. Here's your call light. Make sure that the bed is in the lowest position. I'm going to discard all of my garbage here and remove my gloves. I'm going to wash my hands and document the procedure.